Hi guys, Dr. James LeFever here, Integrative Health Director in Linology, and today we're here to bring you what functional regenerative medicine means to you. Say that 3 times fast, right? So I am here to share with you some ways that you might not have heard of, you might not have even thought of before. The value that I want to bring to this webinar today is to just share some information that you can ponder on what this means to your health, to your family's health, and to the health of somebody that you love. We have a team of practitioners here that range from holistic to allopathic and everywhere in between. I found that when I started practice 12 years ago, I had difficulty helping people in a more complete way. And so when we found the Linology, I found that I didn't have to refer out to another provider, another physician, or another practitioner to get the service you need. I found that when we can do it all under one roof, it makes the biggest difference ever for you and getting the care that you need. So who am I? What does the Linology mean? And what even gets me out of bed in the morning to help you guys, to help people like you? I've got a family. I've got 2 children, actually 1 on the way. My wife, Rita, my son, Liam is 10. My daughter, Mila, is 6. And when I tell you that our purpose and our passion for helping others goes from me all the way down to my youngest child, I mean it. My kids are stretching every day. My kids are on their toothbrushing game morning and night. They know what it means to be healthy, and they know what it means to eat healthy and live healthy. And so I know if my kids can do it, I know if I can instill these values and this purposeful life in them, I know I can help other people do the same that maybe not had that same upbringing or that same intention as they were growing up. And when I say your health is our purpose, I also mean it with a passion, is that your health independence is vital. In order to make chronic pain and disease an option in your life, we have to show you that way. We have to be able to help coach and help guide you. And in order to make an option, you have to know what your options are. And most people think that functional regenerative therapies, well, for starters, some people haven't even heard of functional medicine or functional therapies or regenerative medicine or regenerative therapies. Most of us just understand that when you have a symptom, you go to the doctor and you're getting a prescription or recommendation. And for us, we don't just want you to come to our facility and for us to tell you what to do. We want to help educate and guide you. Remember that doctor means teacher. And when I signed up to be a chiropractic physician, and when I signed up to be the Integrative Health Director here in Linology, I signed up because I wanted to make a difference. I wanted to make an impact in the lives of many people. I don't want to treat the same person over and over again. I want to actually get them well and better and help the next person. And so I'm just a little bit more about me. I mean, what makes me qualified, I guess you could say, to even give you this webinar is that I come from a small town in Temple, Texas. It's not that I come from Texas that I can give you this webinar, but Texas, I grew up in sports, in music, and I worked several jobs in my teens, going into my 20s. I went to chiropractic college in Dallas, Texas at an early age, and I graduated. And right now I'm 37. I've been practicing a little over 12 years now. And not only do I have a specialty in chiropractic, which is called NUCA, is National Upper Cervical Chiropractic Association, but I also have an interest in looking at the entire spine and how it relates to the upper head and neck. The most powerful story I heard was about Christopher Reeve, Superman, being bucked off a horse and damaging the very top part of his head and neck. And when he did that, it affected his entire body. So when I look at how valuable this part of the body is, I actually wanted to be a neurosurgeon in high school. And then I looked at the schooling and I looked at what that entailed as I would grow up and be in my 30s and 40s and 50s. And at that time, I was thinking that I didn't want to help people in a hospital. I wanted to help people before they got to the hospital. And nothing against neurosurgeons or doctors or people that practice in a hospital. My father actually works in a microbiology lab at a hospital still to this day. So I want to try to find a way to utilize all these different modalities that I oversee at Alignology, whether it be exercise and postural therapy or acupuncture, functional regenerative medicine. How can we make those things work better? Been practicing over 10 years and I say I got 50 to go. I say that because I had a disc extrusion that I found back in 2015. So most of you have heard of like a disc herniation or a disc prolapse or a disc protrusion or a disc problem in your body. But most of us haven't heard of a disc extrusion where it's completely blown through the back of the canal. So I had a 15 millimeter extrusion that I found. I woke up one day, I couldn't even get out of bed. I could hardly walk, and I still went to practice. I didn't call in sick for work. I still had people to help, but I was hobbling around the office for literally 5-6 weeks until I start to really feel better. I had chiropractic, I had physical therapy, I had postural therapy, I had some exercise type techniques to help decompress my disc. And it's still, after about that 6-week mark, it was still uncomfortable, but it wasn't nearly as painful. Friends, when I tell you pain shooting down your leg and not being able to put pressure on your leg as a chiropractor is mentally debilitating. And when I didn't do any drugs, I didn't do any surgery. It was recommended to me to see a neuro and orthopedic surgeon, and both the providers that I talked to in those fields had recommended that I did anything I could conservatively to get the pressure off my disc before I even considered surgery. So I did that. And we're going to fast forward to 2018. I redid that same MRI study, and my disc extrusion went from 15 millimeters down to 4 to 5 millimeters. There's some other pathologies on the MRI for those of you who are versed in looking at MRIs, you can see, but this happened years ago. And so a big part of this webinar I want to share with you is you may have an injury that happened in your childhood that you can't really remember or quantify. But when you start looking at the body in different ways and you start using the data that we have today with MRI technology and CT scans and nerve scans, thermography scans, different things that can help us understand what's going on within you, it makes us better as practitioners to be able to help you. And when I share with you some of the things that my wife has been through, I think you'll be astounded. Rita LeFever she's the director here at Alignology. I couldn't do Alignology without her. And for those of you who have already been in Alignology, you know what that means is when she does so much from the office aesthetics, just like she is incredible at orchestrating how a guest gets from point A to point B and the flow is smooth and their care is seamless. But she also has 20 years of leadership experience, and that's really what she's helped me become a better leader. She's helped other women become a better leader with the Executive Women's Council, the Air Force Reserves. She's been in there for, I think we say she's had over 15 good years in the Air Force Reserves and counting. So she's also an investigating health practitioner, and I'll tell you a little bit more about that here in a minute. But you're reading that right. Rita had stage 3 breast cancer back in 2015. And at 34 years of age, it's almost unheard of. And so going through her journey, she realized that when she had back pain, the back pain wasn't something I could even help. We went to physical therapy. She had chiropractic, postural therapy, some of the similar things that I had going on. And mind you, the same time that this was happening to her, the same time back in 2015, my back went out on me. She had more of a chemical, hormonal imbalance. There was a malignancy present, right, with cancer. I had more of an emotional and mental imbalance because I couldn't help my wife. And the two big points I want to play with this is that I had structural issues. I had spine issues that had been ongoing for years that I didn't even know about until my wife was dealing with some issues that I couldn't help her with. And I don't know if some of you can relate to that, but I found that many couples that come in our practice, many families that we've treated, I found that the supporting partner or the supporting individual, whether it be a mom, a dad, a brother, sister, or a spouse, the supporting individual needs care too. And when she and I were both just literally losing our mind, it was imperative for us to act now. We couldn't wait. We couldn't do our research. We couldn't try to find out what's the best approach to this. She had stage 3 breast cancer. And if we didn't act immediately, we could lose her. And that wasn't an option for me. So we exhausted all measures. We upped our game on nutrition, supplementation. We got mental and emotional coaching. That's when she found Investigating Health. And she became a Investigating Health practitioner as a result of her own journey. And you'll see too, she's got a cold cap on her head. She's got these mitts on her hands that are keeping her hands cool so she doesn't get neuropathy. She didn't want to lose her hair, which is why this ice cap is on her head. She lost still about 50% of it, but she still went through chemotherapy. She still went through radiation, as well as combining an integrative approach with Dr. Brian Lewinda, amazing individual here locally at the time. And he helped us understand the importance of integrating holistic care with allopathic care to get a better outcome when you're, especially at a young age. And this is the thing that really excited me about him too, was that at the time, he was doing acupuncture before she got her radiation done to help with pain and to help with anxiety. And friends, I'm telling you, I had acupuncture done before, but it was never explained to me in that way. And so as a result of Rita's journey, and now to this day, she has no evidence of disease because of what she went through over 5 years ago. I'm super blessed that I had providers. We went to Oklahoma, we went to Texas, we talked to people down south of the border, Rosarito. There's an American-owned facility called Synovial down there. And there's so many things. Went to UCLA, California. There's so many places that we went to get the information that we had to get to help Rita. And it was all the little steps. Like, it wasn't this big giant step we had to take. It wasn't this magical cure that we found to help her. It was a lot of little steps that helped us create a more healthy inside for her and myself to help a better outside. And so even though she is a beautiful woman, we've been also married over 12 years. And I can tell you that I know more about her than anyone. And I'm super blessed to have her in my life because she inspires me to be better every single day. And that's really why we're here on the webinar. Now, I got to share this with you too. Becoming proactive versus reactive is something we had to start thinking about, right? Starting a linology was more proactive because me just doing chiropractic in my early years of practice wasn't enough for some of my guests, some of the people that we treated. And so now that we're more proactive, we're actually able to help so many more people in so many different ways without drugs and surgery. So if you prefer just to wait till the symptom comes on, if you prefer to wait till the house catches on fire before you're wanting to really address and assess any electrical issues you might have, or you might have a leak in the roof, or your check engine light is probably the best analogy I got. Let's say your check engine light comes on in your vehicle and we just put a piece of tape over that light. Eventually your car is going to stop working. So we want to be proactive so the symptoms don't worsen, and you want to avoid costing more money and more time in the future, more pain and discomfort. It's one of those things for me, it's like a revolving door. What we found is that most people going through these health journeys, as we like to call it, are struggling because they're merely treating the symptoms, right? If you look below the root of the tree, you'll find that it needs nutrients, it needs water, it needs sunlight, it needs some very critical things to help it grow. If the tree doesn't get sunlight, or it doesn't get nutrients, or it doesn't get the right amount of water or hydration, it's not going to grow well. I think the body is very similar, right? Do we want to treat symptoms, or we want to treat the root cause. Most people want to treat the root cause, but truly they're treating the symptom. And we'll share with you how that is as we go along. When we're looking for you, when we're looking at you to get the best results possible, we have to look at these parameters and what that entails. You have to have the right team, right? The right providers on the team, the MD, the PA, the DC. You have to have some exercise and rehab, some things that you can do at home. I don't want you to always come into the office to get therapy. I want you to learn different tips and different tricks and different things that you can essentially biohack your way of being a better person, from a physical being, a mental, emotional, even spiritually. Weight loss and nutrition is critical. Some people are saying, well, I already eat well, I already eat clean. But I thought the same way, right? When my wife had breast cancer, we were still eating food that was organic. We were still taking supplements, but it wasn't the right stuff for us. There's a bio-individuality that you have to get the right treatment. And that's why we use an integrated medical team approach to do that. And these are all the things that we offer to help achieve that goal for you, whether it be chiropractic, massage, acupuncture, whether it be energy work, postural therapy, nutritional therapy, physiotherapy. There's some cool things that we have in medical literature that talk about bone mass density. And over the age of 55, you start to become more osteoporotic or osteopenic, and your bones start to lose the density that they had when you were younger. So there's a vibration therapy that we use here to help not only neuropathy, but to help bone mass density. We also use an infrared sauna therapy to help with autoimmune conditions, to help boost your immune system. Now more than ever, you need a stronger immune system. We can help you do that. Functional and regenerative medicine, what that means and what are some of the key points in there, whether we do allogeneic umbilical cord derived cellular therapy, PRP, platelet-rich plasma, exosomes, peptides. There is so much that we have to offer that it really depends on what your needs are. And that's why this gentleman, Josiah Smith, is a phenomenal practitioner. He's also our injection king. He's done injections on myself. He's done injections on team members, as well as multiple guests. And I can tell you that when health optimization medicine is the pinnacle or the pillar of what he believes in, he believes in it all the way down to what he practices every day for himself. He does functional regenerative medicine. He helps us write orders and write scripts on what you need based on your health condition. So if you have a condition that warrants some sort of pain medication, he's going to try to find a way to help get you out of pain without helping prescribe the traditional medications that most providers want to do. He's also had his own health journey and health struggles along the way that helped him understand over 22 years of experience that Josiah has. He's seen over 120,000 patients. I mean, his experience speaks for itself. A hormone optimization therapy, peptide, IV therapy. He does so much for the body and helps support our team, as well as Dr. Jacobson. Dr. Jacobson is actually our medical director. He also has his own practice at Wishing Wellness Medical. He has a practice as what we call a concierge style of medicine. So instead of going to the doctor once or twice a year, getting your annual blood work and annual checkup, let's say you're diabetic, and let's say you've been taking diabetic medication for 10 years. The next doctor visit you go on, they check your blood values, they check your objective measurements, your biometrics, your blood pressure, your heart rate, and they say, Mr. John, you're doing great. I'll see you in 6 months. What Dr. Jacobson thinks is, and Josiah is very similar, is they're thinking, how can we minimize the medication you're taking and maximize the way your body is working? Most medical doctors aren't thinking that way, right? And it's not a bad thing that most medical doctors aren't thinking that way. It's just something that we don't believe in more of a holistic approach, more of an integrative approach that's the most beneficial for your body. If you continue taking a medication and the doctor doesn't show you how to do something as simple as Tai Chi or Qigong, these functional body movements that help your blood flow and nerve function, then you may be stuck with this medication for the rest of your life. And so one of the things that Dr. Jacobson likes to dig deep on is how we can provide you a better care and minimize the medication you're taking and optimize the function of your life. Most people are dealing with pain and managing it unsuccessfully, over 50%, right? There's 116 million people in the United States alone that are dealing with pain and managing it unsuccessfully. So how do you fit in this equation? Now, there's a cool video I want to share with you guys. I think that I just want to summarize it. Within this presentation, there are several links to videos. This one is the trailer for Escape Fire. There's a few video testimonials in here. There's also another video towards the end of the last 10 years. And I think what I like to do is I'll share with you the last 10 years video, but I'm going to ask you guys just to check this out on your own. It's about 2 to 3 minutes long. It's powerful. But at the end of the day, what this video talks about is America really healthy? How are we treating our Americans? How are we treating our veterans? How are we managing their conditions of health and their symptoms? We spend more on health than 95% of other countries combined. We consume more than 75% of the world's medication. I mean, if you really think about that, if we're only 5% of the world's population, those numbers are staggering. And when you look at the start of disease and the end of disease, you have to ask yourself, well, if disease starts, how do I know it's starting? Well, we don't know. We don't know often until the symptom happens. And so typically by the time we see our medical doctor and the symptom occurs, we're already chasing the symptom. And so what we like to do at Alignology is identify what your symptoms are, what your history is, and let's trace that all the way back to the beginning of disease. And let's find out how we can get to the end of disease quicker. And not because we want the disease to end, but because we want your life to begin in a more optimized way. Some people, we've done some seminars in the past, and some people think when the disease ends, you die. That's not the case. The disease can end and you live more deeply, more abundantly. You can do things that you weren't doing before. And that's why we do functional regenerative medicine. It's a paradigm shift. And one of the things that I want to share with you guys too, from a condition standpoint, is all these conditions that we treat. I highlighted and read some of the ones that we've had guests ask us to highlight, or to, like, failed back surgery is a good example. I had somebody ask me, do we treat people even after they've had surgery? Absolutely. There are things that we can do to rehabilitate the joint, to regenerate the tissue around the joint that's been surgically operated on, to help break up scar tissue and adhesions. We've treated neuropathy, osteoarthritis, shoulder pain, thyroid issues. Type 2 diabetes is one of my favorite because it's a disorder that and there's medical literature and data that shows this, that if you manage your lifestyle and your diet successfully, it helps the vast majority of people that have type 2 diabetes. A good example of this is nutrition. Most people that think when they're diabetic, they have to have things that are sugar-free. That is correct, but a lot of the sugar-free foods have sucralose and aspartame in them. They're neurotoxic. Well, when we get peripheral neuropathy in our hands and in our feet, when we get pins and needles, these tingling and numbness feelings in our extremities as a result of the nerve decaying or the nerve not functioning right, the last thing we want to put in our body is things that are going to affect our nervous system in a negative way. And so a lot of the sugar-free foods out there that people are doing, especially as we age, are not healthy for you. So there's things that we can do to help educate you guys on that. And friends, I'm telling you, there are plenty of foods and sprouts and in natural grocers and some smaller farmers markets that we can help you understand how it might work better for you. And when we're looking at all these different conditions, the vast majority of them have chronic inflammation as a root cause. And if we can address chronic inflammation through lifestyle and through diet and through all the modalities that we do in our office and this amazing facility, we can help you treat these joints and optimize their function, whether it be a neck, a shoulder, your lower back, your upper back, your your hands, your feet, your hips. My lower back was an issue. It's no longer an issue because I know how to treat it. I know what's going on with it. I've had all the different data points that from the MRI to different therapy modalities to regenerative therapy on myself. And so I can tell you that as a young provider, I've already been to the bottom. I already know what it feels like to crawl in my home and get to I couldn't even go to the bathroom without pain. Like it's just dumbfounding to me that that we can do things to help people, that there's so many things that we have to offer to help people that are not getting the right care. And part of that is just understanding the most basic fundamental idea behind what the anatomy of your synovial joint is. So if you look at all the joints in your body, it's very simple. They're a hydraulic pump and they work under pressure. There are no blood vessels in your joint. So in order for that joint to be nourished, in order for it to have less inflammation, we have to get it moving. Now, some people tell me, well, when I move, it hurts. I can't walk, I can't stretch, I can't exercise. That's what we're here for. We want to get you moving better. In order to do that, there's some fundamental things that we have to address to help facilitate that movement and that pressure change. Now, just like I said before, the injury to that joint, to that nerve, to the disc, to wherever you're having the symptom could have happened many years prior to you actually having the symptoms today. And so that's what we want to see, is how we can look at your body as a whole, not just treating. If you have shoulder pain, I want to be able to look to your neck where those nerves come out to be able to identify where the shoulder pain started. Discovered in the 1970s, I got to talk to you guys briefly about Rene Callier. Back in the 1970s, Dr. Callier found that head in a forward posture can actually add up to 30 pounds more weight and abnormal leverage in your cervical spine. So this can pull the entire spine out of alignment. And I think if you guys look at a side profile of me, my head being more over my shoulders is going to be more advantageous than my head being out over my shoulders. It's going to create more tension in my neck. It's going to create more tension all the way down to my lower back. And that's actually one of the things that was happening with me, is I didn't want to take pain relievers, but I needed to correct my posture. But what also happens over time for some of you, and Dr. Callier found out, is that forward head posture can compress the heart, it compresses the lungs, it affects brain function because you're not getting enough oxygen into your body because of the compression of the diaphragm in the lungs. It also stretches your esophagus, it slows digestion. Peristalsis is the movement of food all the way down through your digestive tract. So when all of that stuff happens, we have to find a way to get it back. But what also happened a few decades ago is Vladimir Yanda, a physiatrist as well, found this thing we call upper and lower cross syndrome. So when you have this upper cross syndrome, you can have your neck flexors, or the muscles in the front of your neck, inhibited, and that also affects your rhomboids and your mid-back between your shoulders. Or your traps and your levator, these muscles in the back part of your neck here, can actually affect your pecs, your pectoralis muscles, your pec major and minor. And so when we look at this, I'm fascinated that most people that go to, let's just say, an orthopedic surgeon for a shoulder issue or a knee issue, we're not exploring this upper lower cross syndrome. And why not do some sort of therapy and treat this individual before we go into surgery? Because far too often we see surgery is the first, what's the word I'm looking for? Surgery is the first action that we take for pain far too often. That's why we're taking more than 75% of the world's medication, and we're managing it unsuccessfully. But if we just implement these protocols, these simple protocols that are medically documented, that have evidence that they work, to train the weak muscles and to treat tight muscles, and use injection protocols that have been there for decades. Here's a really fun fact about JFK. So Janet Travell was a physician that treated JFK back in the day because he actually got ran over by a battleship in World War II. So to this day, Janet Travell and Dr. Travell and the injection protocols she used on JFK are still being used today. And to this day, she is the only non-military physician to treat a president. When I found that out, I knew I had to share that. Some of the history buffs on this webinar are going to just eat that up. Please, I encourage you, go check that out. Go fact check me. It's really neat stuff. But I can also share with you too that the most common joint we treat is knees. So do you need knee help? On the picture on the left, there's normal joint space. That's what the X-ray of a knee should look like. On the picture of the right, the joint space is diminished towards the outside. And so when that happens, the most common treatment is corticosteroid injections and surgery. We want to prevent that from happening. So stage 1 through stage 3 is very simple, very easy to rehab, to implement functional regenerative medicine to help avoid surgery. Once you get to stage 4, we still help many people. And there's actually a gentleman on, 3 on this webinar that I have testimonials with that have had a knee or a hip issue that was bone on bone that needed surgery and did not. So, but we want to prevent it from getting to stage 4. And here's a cool case study that was done by one of our providers. On the knee picture on the right, you can see where there's compression in February 2019 on the right knee picture. And then May 2019, just a few months later, you can see after implementing regenerative therapies, after implementing physical therapy protocols, after looking at how the lower cross syndrome actually in this case affected this individual and decompressing the knee, there's space back. So remember what happens when you get space back in the joint, you allow for movement and nutrients. And so that's what helps rehab the knee, not pain meds, right? And I think we kind of pointed this out a little bit ago, but pain meds don't heal anything. These drugs do not address tissue damage. They don't address the root cause, and they still allow the tissue to degenerate over time. So with degeneration inevitable, when you're just managing pain unsuccessfully, we also look at the side effects of that. Non-steroidal anti-inflammatories or NSAIDs are linked to ulcers, heart attacks, and about 15,000 deaths a year. So what we look at also is this typical treatment cycle. At the top, typically people have joint pain. As you go around, you go over the counter, you buy a over-the-counter ibuprofen or Aleve or Tylenol, something you may have seen in a commercial. You either have the same pain or the pain increases over time. You get a stronger medication from your doctor. Doctor recommends x-rays. Going around the circle, you get corticosteroid injections because the pain's still not gone away. Then we get an MRI. Then we do arthroscopy, which is a relatively non-invasive surgery, as they call it. But typically after 1 to 2 years, the studies show whether you get the arthroscopy or you don't, the results are about the same. And then we're faced with surgery. So all of these things, and this is why in the United States, we are managing it unsuccessfully, because this whole entire circle right here is geared towards treating a symptom, not addressing the cause. It's treating a symptom. Now, occasionally the doctor will recommend physical therapy, which begins to get to the root cause. But if you don't add anything to help it heal, like cortisone injections or corticosteroid injections, don't help it heal. So if you're getting physical therapy with cortisone, you might actually start to feel better for a few months, for a year or two, but eventually you're going to get back stuck in that same circle, that same cycle again, and add another joint to it. Corticosteroids are used to break the scar tissue down, which they do very, very well, but it also degrades the bone density. And so we talked a little bit about osteoarthritis or osteopenia over the age of 55. And if you continue to have these issues, you're not only dealing with the age factor, the age-related degenerative changes that could happen, that don't always have to happen, but could, but you're also dealing with pain that can increase as the disease increases. So diabetes is another one that corticosteroids can affect and impact negatively. And that's why you can only have 3 to 4 injections per year, because it also suppresses your ability to fight infections. So the other thing, hyaluronic acid injections can be helpful. They're from a rooster comb. They're a natural substance that helps you repair cartilage and tissue, but it does not grow new cartilage. So that's why the FDA approves 3 to 5 injections per year. It's very safe and actually covered by most insurance companies. We typically don't offer it here because we look at this as more holistic or more natural Band-Aid on a long-term problem still. So all hyaluronic acid really does is buys time and puts off knee surgery. I believe we can still use this in a shoulder or a hip, but definitely not advantageous for like a neck or a lower back issue. So we want to avoid this. We want to avoid any surgical procedures or interventions to replace a joint, and we want to try to catch it before you have to face this. $57,000 is the average amount of an uncomplicated case of knee surgery. And it varies from hip and shoulder and back and neck surgery. The cost varies, but I like to use knees because knees are the most common. Now you might be saying, well, Dr. LeFever, I don't have knee issues. I have lower back issues. Well, the same principle applies. There's really no guarantee. There's a high percentage of failure and complications on any surgery, and 50% or more of knee surgeries will actually need an additional surgery. And what's the cost of your time, your function, the pain and suffering you've endured? We really don't know, right? Rehab is painful and it can take months. And when I hear somebody like Jonah mention that everything looks good, there's nothing left to do, that her surgeon said, if a surgeon has done everything that they can to help the joint out and they're not able to do anything further, that's where we come into play. But I think for me, if I give it my best, if our team gives it our best, it's rare that you're going to hear any of us say, there's nothing, everything looks good, there's nothing left to do. It's very rare that we lose somebody to surgery, because unless the joint is completely abolished and obliterated, there is always hope and we can always help. And when I look at this, I feel like hearing things like that, hearing stories like that I've endured with my wife, with other families that we've helped, I feel like it's time for a change. And this is where we're going to introduce the regenerative therapy component. So if you've listened up to this point and you're like, you know what, I'm just ready to come in, you've given me enough information and knowledge, skip to the last 10 minutes of the presentation and we'll tackle that with you. We'll go over some things that we can offer and we can help you with. But we want to be able to save you guys time and money. And that's why we're here. We're going to dive into this regenerative therapy. So if you're still with me, hang with me. We've got about another 20, 25 minutes left. We're going to keep going at this. But research has gone back over 100 years, right? This Dr. Maximilian Stern actually took a burn victim. He went over the L&D ward where they're delivering babies. He took a placenta and Dr. Stern took a placenta from the labor and delivery ward back over to the burn ward and put this on a burn victim. And the placenta actually helped the skin regrow better than it was before. The membrane of the amnion actually helps ulcerated surfaces. It helps with skin grafting and things like that. So for me, if this has been here for over 100 years, why are we not using it more? And why do we have to go through all these different political things just to get what we need? I understand the process and procedures that need to be taken place to protect us as Americans. But at the end of the day, there are other countries that have been doing these regenerative therapies for decades, which is as a result of Dr. Stern's research. In fact, we've known about umbilical cord derived cells and stem cellular therapy since the 1870s. So why does it take us to 2012 to figure out that we can start funding this stem cell research and be able to do some great things with it? But prior to that, in 2009, there's a lot of Americans, and typically wealthier Americans, going to Dominican Republic, Costa Rica, Panama, and other countries overseas. In fact, there's a Dr. Neil Reardon has a regenerative therapy clinic in Panama. And it's about $25,000 to go down there for any procedure you want to get. It's $25,000 and up. We've actually had one of our guests go down there, had the procedure done, came back, and it was ineffective. And I'm here to tell you too, at $25,000 to go out of the country to get something done with a higher risk, in my opinion, is not something I want to do, is not something I would want to offer for you. So that's why in here, what we do, it's significantly less than $25,000 for most people. And just to get your joint rehabbed, looking at the data that all these different colleges have put forth for regenerative therapy and regenerative medicine, looking at these different high profile athletes and high profile political figures and people in the public, that most people know Suzanne Summers, most people know Tiger Woods. In fact, Tiger was one of the first well-known figures to get PRP, or platelet-rich plasma therapy. And since he's done other regenerative therapies too to keep him in the game, right? Steph Curry, Michael Jordan, Rafael Nadal. There's Kobe, the late great Kobe. Man, he at one point, there's data out there that showed that he had invested over $1 million in regenerative therapies. A-Rod and Peyton Manning. I mean, these are some amazing individuals that have created legacies for themselves and for their families, and they have wealth beyond the means that most of us do. And for them to stay in the game takes a much higher level of care than it does for the average Joe or Jane like you and I. And so I'm here to tell you that we can offer therapies like this, and you don't have to have an income like a football player or like a basketball player. In fact, a lot of the therapies we do, we can get you set up on some sort of payment plans. We can get you set up on a schedule that works best for your finances. So PRP, platelet-rich plasma therapy, also mesenchymal stem cell therapy or medicinal signaling cells are working because they're the regenerative factors, there's anti-inflammatory factors, there are immunomodulatory factors. I mean, there is so much value in utilizing these therapies for your body that orthopedic surgeons are doing it, regenerative medicine integrated facilities like ours are doing it, and everywhere in between. It's just not being used enough, and taking what we already know about an infant and a newborn and taking their body and the bio individuality of you, maybe you're Tom Brady's age, maybe you're grandma and grandpa's age, but our cellular regeneration, even at my age, is not as good as a baby's. If I fall and hit my head and face down, it's going to take me a while to get back up. If a baby falls and hits their head face down, they're going to get right back up and keep moving. But this is also kind of what I was mentioning, is that even though babies and toddlers can actually heal relatively quickly compared to us and us as adults, they also have more exosomes than we do. They also have more medicinal signaling cells than we do. So if we can fast track our healing process at whatever age we are, we want to do that. We want to do it safely, and we want to do it without side effects. And that's why we use exosomes as a therapy. They are acellular. They're 1/1000th the size of a cell, and they help signal your cells to function better. And these are all the things that they help signal. I know this font is very small, but what this goes through is the angiogenesis, or the different signaling cells that are needed for more blood flow. This goes through chemotaxis. This goes through tissue regeneration and wound repair, kind of like Maximilian Stern did with that study back in 1913. This goes through tumor suppressor genes. Amazing data on what growth factors on the inside of your body can do when they work better. And when we look at how exosomes, or this regenerative technology, can work, it actually turns on more than 1,000 signaling proteins in your body. And it turns off different things like chronic inflammatory cytokines, the matrix of catabolic things that break down tissue, that break down bone, and many other signaling pathways. So we want to flip the switches off that need to be off, and we want to flip the switches on that need to be turned on. And that's what exosomes do. What do you guys think so far, right? Are you tired of putting off the pain? Has it affected your relationships? Has it affected your ability to work? Has it affected your ability to enjoy life? Absolutely, right? So It affected mine. I know it affected many of yours. And this is one of the first testimonies I want to share with you guys. Now, again, there's a link that has his video testimonial and the little handout for this presentation. So I encourage you to check out all those videos later. But just in summary, Mr. Jose was actually he was a pediatrician. So he's a retired MD. And at 81, his worst fear was getting a hip replacement. He had a hip that was severely degenerated, that was bone on bone, and he's one that was more in that stage 4 osteoarthritic change in the joint. And our medical team wasn't sure if it was going to benefit him. We evaluated him. We looked at all the parameters and all the possibilities that would be able to help him. And 6 months post-treatment, after he said, I would rather do this than surgery, we committed to him. We did rehab, we did therapy, we did exosome-based therapy, gave him some exercise, some different protocols, some lifestyle recommendations and nutrition to do at home. And at this point in his hip, he's able to sleep through the night. He's able to walk without assistance. In fact, his wife can hardly keep up with him. So here's a cool picture of the two of them. This is a little snapshot of their video. The next one I want to share with you guys, over 25 years of pain and suffering that Mark had to endure. And on the day of his procedural injection, he thought it was a miracle. His pain went from a 9 to a 1. That doesn't happen often, but it definitely happens frequently. Now, prior to surgery, he needed a replacement. He had meniscal fraying and tearing. He had what's called tricompartmental osteoarthritis. Now, for his trade, he's a painter by trade. For his trade, for those of you who know what painters, electricians, those different trades do, it's very physical. And surgery wasn't an option for him, or it was an option, but he didn't want to give it an option because he would have to take time off of work. There'd be a rehab, and there just wasn't any guarantee. And this is just a great picture too of all the different things that I've done for myself. I'm getting injection with Josiah in that bottom left picture. Josiah's doing some post-breast cancer regenerative therapy with Rita on the top left. In the middle is a good friend of ours, Naomi. She's getting regenerative therapy, and she's one of the youngest individuals we had do this in her late 30s. And then and our aunt on the right side of the picture, Auntie Widad, also getting some regenerative therapies. So Richard, another powerful testimonial, he had neck, shoulder, hip, and lumbar spine issues. He's feeling amazing. He's got it's about a 10-minute video for him, but he's got a great, powerful testimonial. I treated Richard for almost 10 years prior to him getting regenerative therapy. And so this is really one of my, ones that almost makes me a little teary-eyed, because the amount of pain that he went through post-surgery, post-neck fusion, 2 surgeries at that, is just dumbfounding to me. I'm actually going to be doing a consultation on a young lady next week that had 3 hip replacements on the same hip because of infections. And it's just, these stories are really why I get out of bed every morning, to help empower you guys to know that there is hope. Surgery and drugs are not a last resort, or not even a first resort. They don't have to be guaranteed. They don't have to be something that is necessary for you. You got to look at all your options, just like Dawn did. Dawn here, another powerful video, was a caregiver to her spouse. Her husband had Parkinson's and had a deep brain stimulation done. And so for her to be able to care for him and to deal with rheumatoid arthritis and to deal with knee issues that she had was just not an option. She came in, regenerative therapy. The second day she had, after the day after the regenerative therapy, she's completely pain-free and just couldn't believe how much it benefited her. Those of you who are on here that are wanting to know what it looks like in the office, how long it could take, it's about a 1-hour procedure in office. There's no anesthesia. There's no hospital stays. There's 0 recovery time. But clinically, we expect to see significant improvement within 1 to 3 months. And there's minimal adverse effects. And we're talking the adverse effects are like localized redness where the injection site is, mild fever, mild aches at the injection site. But Tracy is another powerful testimonial. Some of you might know people who have Parkinson's disease, Alzheimer's. There are things that we can do here to help them. And for him, his father actually had Parkinson's. Tracy has stage 4. But within a few weeks, within 4 weeks, he had marked regression of his tremors, his sleep. And I actually just saw Tracy yesterday, still doing very, very well. He actually just hiked Mount Kilimanjaro, if you can believe that. He's hiked all 48 highest peaks in the United States, minus Alaska and Hawaii. So amazing story he's got. Parkinson's disease, heart disease. I'm just going to skip through these real quick so we can fast track this for you guys. Type 2 diabetes. These are all things. Alzheimer's. This is what happens to the nervous system as it starts to degenerate. Thyroid dysregulation. The thyroid, I like this picture because it's not just a thyroid issue. It's a pituitary gland issue. It's a hypothalamus. It's a sex hormone issue. So there are things that we can do to help figure out how to completely treat you if you have those conditions. Acupuncture and stroke also go hand in hand with regenerative therapy. There's a great study done on that back in 2016. Regenerative therapy and lung repair. Now, this is what also fascinates me is this evidence is out there that there's almost 350 people that at the Lung Institute, they went through a 3-month study of treatment with regenerative therapy, and they found that 84.5% of them found quality of life improved. 84.5. I mean, that's unbelievable. Jackie, another powerful testimonial. She had ulcerative colitis. She had an entire large intestine removed. I treated her for about 7 years before she met Josiah, and we did regenerative therapies with her. And to this date, she's not getting iron infusions on a monthly basis. She's not having to deal with bowel activity that's just painful. She's not having to deal with certain aches and symptoms that she had to deal with before. She just has a better outlook on life, and very blessed to have her as a friend. Jackie's doing amazing. This was a text message that she had sent Josiah a week after her treatment. But let me think about this for a second. So what would your last 10 years look like? And even 20 years, right? Let's say you're in your late 60s right now and you're looking at your late 70s to 80s. What would those last 10 to 20 years of your life look like? There's a very powerful video that I wanted to share with you guys. I'm looking at the time. I'm running a little short on time, but that video is also in here. What I want to share with you guys about this is that I lost my grandmother earlier this year, and I can tell you that she lived her life the way she wanted to, how she wanted to, and has no regrets. And that's what we're hoping for you guys. And when the last 10 to 20 years of your life looks like a slow, gradual decline, we have to think about how can we do this better? How can we keep you here at the top? And as soon as you go out at the top. You don't go out at the bottom. And I know my grandmother went out at the top. I want to go out at the top. And that's what we wish for each and every one of you. So if you'd like to find out if we can help, raise your hand. I can't see them, but I'm hoping you're raising them. This past hour, I hope you'd agree that the time was well spent. Learn some life transforming information. Or if you're interested to feel the linology difference, I have a very, very special offer for you guys. Let's see what we can do. But before that, I want you to think about how we can roll the clock back a few years. Would it be worth it? If we got you out of pain, would it be worth it? What's that value to you? How about avoiding more drugs, more surgery, more doctor's appointments? Would it be worth it? Right? There's a great slide that I had taken out of here, but I just want to run this down with you. So as you're looking at this, what the linology difference means is we have functional regenerative therapy protocols that most providers do not. We have integrative physical medicine with chiropractic, acupuncture, massage therapy, and physiotherapy modalities that we can help you with. We also have nutritional therapists that we can help you with, a marriage and family therapist, investigating health therapist, and energy practitioner, supplements that all help create a better environment for your body to thrive in. And to this day, my wife has no evidence of disease, no evidence of breast cancer after chemotherapy, radiation, full mastectomy and reconstruction. To this day, she has that. To this day, I am asymptomatic in my back, and many of our guests are because of this, because we do an integrated medical team approach where most people that come in, they're investing over $330 to over $400 on their initial eval with x-rays if necessary. For you, we're going to give you a 50% discount for just being on this seminar, and we're offering a special of $147 to do that entire integrated medical team approach. You'll get a provider that's going to fully examine you and your condition, review your history, any labs, any x-rays, any imaging that you've done. And then we're going to have one of our medical team come in and evaluate you medically to see if there's anything that we need to do from an allopathic perspective and how we can integrate allopathic and holistic medicine to help you get to where you need to be. A lot of people ask questions about what the cost is. Do you take my insurance? Those are all fantastic questions. It really depends on you. It depends on your insurance company. It depends on what they have available and what they provide benefits to you. Typically, the investment ranges from $500 upwards to about $6,000 for the regenerative therapy. And so what we want to do is we want to help you and serve you in whatever capacity you need. So let's get you in for a discounted consultation. Let's do a medical eval on you to give you the best options and see what's right for you. Another question we had is, what if I'm very sedentary? What if I really don't want to get out much? Or the other question, the other spectrum is, what if I'm an elite athlete? What does this mean to me? We're going to meet your needs wherever you're at. If you're more sedentary and you want to get to more moderate lifestyle, if you're more moderate and you want to become an athlete, we can help you get there. Based on your needs, we're going to find out what approach works best for you, what therapies work best for you. I'll leave you with one of my favorite quotes from Bruce Lee. Knowing is not enough, we must apply, and willing is not enough, we must do. And there's a quick disclaimer. I want to make sure you guys don't mistake any of the information that I just gave you. There is no promises I can give you. There's no guarantees I can give you that are going to guarantee that your condition is going to be completely eliminated and cured. But what I can guarantee and promise you is that I'm going to give you best, and is going to give you my best, and we're going to make sure that if we can help you, you understand what that means and how that benefits you and your family. And if we can't help you, we'll also tell you. But I want to make sure that you know that we are not promising that we can cure you or treat you without even seeing you. So thank you so much for being here. I encourage you guys to take that opportunity to have to do a consultation. If you have any questions at all, please leave the comments in the presentation. There's a place for you to write questions. I will get those and I will make sure our team contacts you. You also have our contact information below. But thank you guys all for being here, and I look forward to seeing you soon.